Welcome, welcome, welcome. Thank you so much for joining me today. Today, we are going to discuss neurodivergence and its connection to substance use and abuse. We're going to explore how individuals with learning and thinking differences may be at greater risk for substance use and what to do about it. Eric Rydzewski and Chris Wilson are joining me today. Eric is a licensed professional counselor who specializes in working with adolescents and young adults with comorbid neurodivergent stress and addiction issues. Chris is a sobriety, ADHD, and life coach. He helps his clients establish lifestyle changes that encourage a healthy life while practicing resiliency in the face of relapse, attention challenges, and identity struggles.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Eric and Chris, thank you so much for being here.
Thanks for having us.
It's really great to have you. I'm glad that we were connected because I've always wanted to talk on the podcast about substance use, about substance abuse, particularly in our children, teens, young adults who think and learn differently. There's a lot of misinformation about the link between neurodivergence and substance use. And then there are things that people just aren't aware of in terms of the relationship between differences in the wiring of the brain and even vulnerability to substance use. And I know that you both do a lot of work in this space. So I'm just thrilled to have you both here.
Thrilled to be here.
And there's a lot to unpack. We can't answer all the questions, but we will definitely talk about some of this. And I was reading some of the research before I kind of came on the podcast today. And, there's research that shows that teenagers with ADHD are more likely to use substances like drugs and alcohol, and even young adults who are at risk or seem to have symptoms associated with autism spectrum disorder also seem to be at greater risk for using some substances. And this is concerning for parents. It's concerning for people who care about the young people in their lives, and they want to minimize those risks. And I would love for you both to kind of talk about what you've seen in the work that you do with young people, and then we'll go from there.
Yeah, maybe a good place to start is I work with a lot of we work with a lot of preteens and adolescents and young adults who were diagnosed at a pretty young age, and then their brains continue to develop. And sometimes what happens is they're just exposed at a young age to some coping mechanisms that give a pretty quick release, whether it's gaming and just finding or just screens, internet-based gaming. I think especially because a lot of those games now are, I think, engineered to just stimulate the already kind of vulnerable brain of a neurodiverse person, or caffeine or sugar. And then as you get older, as that person gets older, they learn that there's that quicker release for their already like hyperactive and overloaded nervous systems is, like it just becomes like their go-to when they, as they get older, and then alcohol and weed and other substances just become more readily available.
Yeah, I also would say that getting a diagnosis of neurodivergence, ADHD or autism, can affect your one sense of self-worth and confidence. And a drug can be a quick fix for that. If you feel bad, you can drink or use marijuana, super common. And that can quickly become dependent, a crutch. And then a few years of practicing that behavior, and you could have an addiction issue.
Yeah, I think people with neurodiverse brains, folks who process information differently, and we're talking about, of course, autism spectrum disorder, ADHD, nonverbal learning disorder, um, and folks who don't have official diagnosis. There are a couple of books. Howell and Rady are a couple of folks who have written Driven to Distraction, ADHD 2.0. I love those two, and they created a term in their newest book, ADHD 2.0, called that the acronym is VAST. It's variable attention stimulus trait, and it's this. Essentially, it describes everyone who doesn't have a diagnosis but has ADHD traits. And so, I think like it's hard to have this conversation and not talk about ADHD and autism spectrum disorder, and then there is all of the other just neurodivergent diagnoses out there, and then there's everyone else who doesn't. Like I was diagnosed with ADHD at a young age, and I know, and we work with a lot of folks who don't have and they don't really need that diagnosis to be aware and mindful that they're susceptible to wanting that dopamine quick fix, and then it just kind of spirals from there for all those folks.
Right, and it may be that some kids with ADHD or even anxiety, for that matter, may seem drawn to substances that make them feel calm, and at the same time, there may be other individuals with a different neurodivergent presentations who may be seeking stimulation, right? Because the way their brains are wired, they may feel understimulated. And that's because neurodivergence varies from person to person, which means that everyone experiences neurodivergence differently, which is kind of what you're saying. And that may be especially true in relation to substance use and the types of substances that they seek out or may be more likely to seek out.
Absolutely. Anything that hits the brakes on a brain that just seeks stimulus is going to be a really easy go-to. Alcohol, weed, they're just great at watering down that overloaded brain and that already overstimulated brain. Yeah, and I mean, who wouldn't want to just if a person is really struggling with slowing down, whether it's in school or with their friends, or they're feeling self-conscious, why wouldn't a person want to just press that button? It's just so easy to if you could just press a button, take a pill, drink a drink, smoke a joint, eat an edible, whatever, and then slow down. And that sort of I like the phrase hits the brakes or numb, or even watering something down. Who wouldn't want to go there? And so I think that's, as far as treating those folks, that's usually where I start. It's what are the benefits? What do you really like about it? And then that that a person's understanding. My hope is that a person's understanding leads to that, their choice of whether they want to do things differently or not.
Yeah, we're all very good at self-medication now. Been training in the Western society, at least, for quite some time.
Right. And I like that you mentioned alcohol, because oftentimes when we think about substances, our brain normally goes to illicit drugs, and that's what we're talking about. But in fact, clinicians, researchers, individuals who work with young people like you have reported that alcohol can be a coping mechanism for neurodivergent teens, because some of the things that you've said, that it helps them manage the academic struggles. It can help manage sensory processing challenges, boredom, right? A lot of different things. And also I think about it as there's also this, even though we know that their brains are wired differently in individuals who are neurodivergent, but there's also societal pressures as well, right? There's a lot of social pressure for students who think and learn differently, who experience the world differently, because teens want to fit in with their peers. They want to be socially accepted. And when you're socially isolated, using alcohol with other individuals, or using marijuana for that matter, might be a way for them to connect. Have you seen that in the work you've done with teens?
In a sense, they're all performance enhancing drugs. Whether it's actually kids when I was in college, and this was quite some time ago now, using ADHD drugs that didn't have a diagnosis to perform to kids that do have a diagnosis, using large quantities way over what they were prescribed, as well as using alcohol if they had social anxiety, sometimes wrapped up in the fact that they have ADHD or ASD diagnosis. So I've seen that. Yeah. I would say it's very common.
Yeah, it's interesting how you talk about it as a performance enhancing drug, because that could be social performance, right?
That's really what I mean.
Absolutely. It's so interesting to think about that term and apply it to social situations.
Yeah. They'll come right out and say it. I drink a little bit so that I can be part of the party, so that I can, as what an introvert, be more extroverted. So yeah, I think it's very common. I think it's very common across society, neurodivergent or neuroparticular or not.
Right. And it's interesting how in some cases, and in many cases, students aren't seeking to get a high from these substances. They're actually like seeking out some relief from some uncomfortable experiences that they're having. Some of the things we talked about may even be for individuals with ADHD or some other psychiatric issues, racing thoughts or irritability that they're experiencing that's causing them discomfort, and they want to address that.
Absolutely, and it's not always conscious too. There's oftentimes it might just start as some curiosity or wanting to fit in with a certain group. There's a group at every school and in a community where it doesn't take much to be a member. All you have to do is join in. Whether it's like with a group of friends wanting to like get high or drink. Or whatever it looks like, and then that, tends to lead to as the brain develops and someone gets older. And I think that's when something really becomes a problem, when it turns into that dependence. It is back to that like curiosity around what a person likes about it and what the benefits are. Like in this conversation, I think it's really easy to judge and start talking about those labels, and this, like, we're talking about addiction right now, and that's like a really heavy label that I actually think like can at times create a little bit of disconnection versus like that like leaning in, which is like the meta message, that the broader message we're talking about too, with a susceptible brain, with like somebody who thinks a little bit and processes information a little bit differently. I love that we're talking about like the good, the really good things, the benefits right now of drinking. Like, oh yeah, it helps you fit in. It makes sense that you like drinking. It absolutely does.
Right. And when you listen to young people tell you that this is why they're using these substances, are there themes that come up that are similar across the teams you work with? And when do we go from it being substance use to being an addiction? And what does that look like in the lives of these young people? I think that's really important.
Well, I think once it starts impacting their health, their performance in social relationships, as well as school and profession, I think it becomes pretty clear at a certain point that what used to be a crutch or a release is now surpassed the problem that it was, quote unquote, being used to treat. And then you have to address that to get back to ground zero and start working on whatever your neuro particular performance is.
Yeah, and when a person is unable, when a person's dependence, I think, gets to that point where they just can't stop, I think as well, because like you could function, and we work with a lot of folks that function really well, and they get good grades, and they continue, to use, and then especially with like preteens and adolescents and adults too, the intervention usually comes from a family member or a loved one. I like the idea of like almost like intermittent fasting with whether it's gaming or substances. Because we work with a lot of folks who just have an unhealthy, I would say air quote, unhealthy relationship with, with other things besides substances too. Can you stop for a couple of days and let the dust settle in your brain? Or are you, when you take a pause, when you fast for a little bit, are you so preoccupied with this thing that is no longer in your life that you can't focus and you can't concentrate on anything else? Like for me, that's when I would have the conversation about not whether or not a person is an addict, but whether or not someone, is addicted to something. Because they are, I think that's an important differentiation, that the term addict can, like someone has to be like ready for that. I would say, in the recovery world, someone has to be literally open to it, versus like, hey, let's talk about like this thing in your life that you're having a hard time hitting the brakes on, like pulling away from.
And that's a really important distinction between using a substance or using, technology. If, you talked about gaming initially, and it crossing that threshold where it becomes a problem for teens, where they can't stop themselves and it's interfering with their ability to do the things they would normally do. Things like interacting with peers, doing well in school, interacting with family members, and being consumed by either a substance or something else that is taking them out of that and impacting their quality of life and even their physical health in the case of substances.
Yeah.
Right? Yeah, absolutely, Karen. It's like a teenager's job, their role is to experiment and be impulsive in a lot of ways. And then, a neurodivergent and a neurodiverse, somebody who just processes information a little bit differently, preteen and adolescent, is going to be way more impulsive. And so the risk is going to be a little bit higher for substances and other addictions. Yeah. It's kind of a messy, perfect storm.
Absolutely. And when you mention impulsivity, I'm thinking again of these young people with ADHD, where impulsivity is one of the symptoms of ADHD. And then you pair that with an underdeveloped frontal lobe, which is responsible for decision making and judgment.
That's right.
Again, it's like you're describing that perfect storm.
I like to look at general wellness too, obviously like self-care, diet, exercise, sleep. Their screen time and social media habits are huge. How much time are they playing actually having one-on-one and group connections with their peers and family members and so on, whether or not they're being isolated by their behaviors. And a lot of it, I think, when you want to address, questions like executive functioning, the best things I know how to do are eat well, sleep well, and exercise. That works across the board for all people. And we've worked with some kids who were high performers in some ways, but they had a diagnosis. They wanted to deal with executive functioning issues. And then we start kind of assessing where they're at. And then we find out that they're not eating protein at all. They're just eating like breakfast cereals or something like that. And then that's like ground zero to me. Like, start eating healthy, and I guarantee you will see improvement. And then maybe that shoring up their general life performance and health will help them separate a little bit from what they might be using as a crutch, as a substance, something like that. Replacement behaviors is a big part of what I try to instill.
Yeah, it's really hard to treat. It's really hard to help someone who isn't, taking care of their body, sleeping, and eating well, taking their meds, all those things.
Yes, and what you're describing, are really all of the factors that can put teens and young people at risk for substance use, but also a holistic approach to intervention and treatment. So nutrition and sleep and exercise, and also developing more adaptive and effective coping strategies. How do you cope with boredom? How do you deal with the stressors that you're experiencing in your life? How do you deal with social isolation or the racing thoughts that are associated with ADHD? Is that part of the approach that you take when you're working with students in terms of how to address these things that are contributing to the substance use and dependence.
Absolutely. If I could teach them all, like I said, self-care and then resiliency, I pretty much feel confident that the big portion of my job is done. It's the ability to identify and then address their problems instead of using something else to either distract or cover up or blow through the issues that they're facing.
Yeah, helping someone create structure, helping a young person and helping parents and families create structure for their kiddos too. I really like checklists. I find that that's really helpful, especially when you're working with somebody that like has some executive functioning struggles and they have a really, really hard time creating structure for themselves. I find that to be really helpful. And then, breaking up their day by, doing some like practicing some opposite action and going for a walk, regardless of whether or not you want to. Yeah. And the list goes on.
Right. Doing those things that, again, like you're saying, they may not want to, but would actually be beneficial to their mental health. Because as we know that there's a lot of co-occurrence of neurodivergent presentations like ADHD or dyslexia and other mental health conditions like depression and anxiety, which can even increase the likelihood of using substances for kids and teens.
Yeah, there's going to be discomfort if you want your life to improve, if you want to feel better, if you're struggling with a loved one or you yourself are struggling with an addiction and you're already overwhelmed and overstimulated and flooded on a regular basis. So I think I start with that, like, hey, this is going to be uncomfortable, maybe even a little painful. Are you open to that? Are you open to some discomfort? Yeah, and kind of going from there.
Yeah, distress tolerance.
That's right.
That's a skill that we all need. And kids, I think that's what they're at that time in life where they're like facing that and running from that at the same time. We want them to be able to sit with their feelings and let them flow through them and pass and then remain themselves instead of give me this thing that will make me feel this other way, Right.
And while they're sitting there with those feelings, it sounds like they need to be given tools to how to help themselves and how to deal with the discomfort at the same time that they're experiencing it.
Mm-hmm.
100%. Yeah, absolutely. Yeah, lots of I love, again, back to like my checklists. Like I love lists of coping skills. Okay, before you give into whatever this urge, like let's check off all these boxes, like show yourself that you've tried all these things. And if you still want to do it, okay, go for it. But try all these things first. Yeah, that's something that the actionable stuff is something that I think parents and families can help their kids with too, especially when their kiddos are really struggling with like whatever it is that they're whatever, air quote, unhealthy coping skill they're struggling with. Addictions are just coping skills.
And in the context of raising awareness, reducing stigma, what steps have you found to be helpful for families to support teens, young people in their lives who may be struggling with substance use, abuse, or dependence?
Love, support, but holding boundaries. I think what we see sometimes is that parents get lost themselves and they don't know what to do. And they forget to parent because of that, when they really need to have healthy, strong boundaries and hold their children accountable in a healthy, reasonable way. I don't work so much with the parents, but I do see that being a critical step to helping their children.
It'd be really nice if there were one clean answer to that, Karen. Like I think every family is different and they have to be treated differently. I mean, I do a lot of intervention work with parents and families and their kiddos, and we do because we're like Aspen Growth Coaching is like in the home with the family, and so oftentimes, there's and I use the term intervention pretty loosely here. Just intervention meaning, you're going to kind of step in and have a difficult conversation with your child, preteen, teenage, or young adult child. And in general, I would say there's a lot of fear around that conversation between parents and their kids, and asking for help from a community resource, whether it's, like a clinician, a professional, a coach, is it a great way of not feeling like you're on an island, not feeling like you're alone, because there are thousands, and as we know, thousands and thousands of families in the U.S. alone, just in the U.S., they're dealing with this all the time, support groups, etc. And your child is not they're more capable and less fragile than you think they are. I think that's probably a catch-all message that I would say that I found to be true, like over 100% of the time, is like your kiddo, is not as fragile. They're more capable than you think they are. They can handle this difficult conversation, and they can even handle like some rules. And parents are often have a really hard time saying no when their child is kind of wrapped up in that addiction cycle. And so then it becomes the parents' work. I think, my opinion is, it becomes the parents' work to learn how to kind of say no and hold those boundaries. And then more importantly, if not equally as importantly, it's the kiddo's work to learn how to hear that word no. And then, kind of find some form of homeostasis in that like often messy dance. I don't know if I answered your question, but
You absolutely did. And I think, the take home is that each family is going to be different. And, I'm hearing love, support, and also setting boundaries. And, I think you talked about, Chris, resilience being such a big factor. And we know that one of the best ways to develop resilience is for individuals to feel that they have a caring person in their lives who they can trust. And knowing that that person is willing to have those difficult conversations with them will only help build that resilience. And then at the same time, help that teen, that young person, develop more effective coping mechanisms to deal with the struggles that they're facing.
Yeah. So it ends up taking some distress tolerance on the parents' parts as well, to have those difficult conversations where you're face to face with your child, dealing with these problems and being honest and open about it, instead of eliding it or just falling back on a strict disciplinarian command model. I think you have to kind of like find them and see where they're at and help them where they are.
Yeah, and listen.
And listen.
It's a big part of that. That certainly helps. Like really listening to your kiddo.
Yeah.
Right. And when you get that listening, and the student, the young person, is willing to participate in some kind of intervention, some therapy, some family approach or individual approach, or both, what can it look like when there is an intervention that works?
Oh, yeah. I mean, that's, again, back to that. Like I said, I'm just like rifling through like the Rolodex of, like those interventions. And I do think every one is really different. I'll give you an example of one recently. This looked like the parents, it was an 18-year-old, diagnosed on the spectrum, went away to school. The parents, he was able to graduate. It was incredibly difficult, brilliant mind, like genius. I mean, like a mental level intelligent in some ways, but significant executive functioning struggles, as you can imagine, difficulty like managing his emotions. The parents wanted to give him a chance. He went to school, went to college, and then at college, things kind of started to fall apart, socially isolated, not wanting to leave his room. The credit to the school, like the dean got involved. And what ended up happening is that the parents, I think, were trying to give their son so many chances. They were doing a great job of listening, and this young man, as a result, was able to learn on his own that he, in the end, like he wasn't ready for school. And I think what helped was that we were able to help the parents formulate a message to the kiddo, because they really were stuck in this, well, you need to do this, you should do this, you have to do this, versus, well, here's what I'm willing to support for you. Here's what I'm going to do everything within my power to support healthy choices, what I feel are healthy choices, my opinion, and I'm not going to support these self-destructive decisions that you're making. And when they were able to give him that structured message, he was able to make some of those choices within like what his parents were able to, to support for him. And in the end, this young man ended up going to treatment, and he's doing really, really well right now. He's taking, I would say he's in a gap year. So that's like that I think would be like an extreme version of an intervention, like a high level. But I think in the end, the parents clarifying what they were willing to support for this young man really helped him be able to decide for himself, oh, okay, so my choices are, like, I can take my parents' support, or I can continue to try and do this thing that, like, I recognize and I realize is not helping me get what I want, which is a college degree. And I think he's going to do really well long term. I think it's like sacrificing what he wants short term in order to get that long term stuff, like a college degree.
Yeah. And it just seems that, having a good understanding of what that looks like, because, parents can have these expectations for their kids, but kids might have different expectations for themselves. And again, having that conversation is so important between the young person and their parent, again, about what do you want for your life? What do we want for you? And then what, again, like you're saying, what are we willing as parents to support for our children, and recognizing when they are on a self-destructive path and providing that support to help them through it, so that in the end, they can live a healthy life, which I think is what we all want for ourselves and what we want for the people that we love and care about in our lives.
Yep. Healthy and independent.
Yes. Healthy and independent. And, this is just really an important conversation for raising awareness about the struggles that many students face who think and learn differently, the struggles that students face when they have mental health challenges, and how important support and understanding is for these young people, and how we may not be able to stop them from experimenting or using substances, but with more information, we can understand why they might be more vulnerable to using substances, more vulnerable to being addicted, and then what we can do to support them and also minimize the impact of some of those behaviors, which can be destructive. Eric and Chris, thank you so much for being here. If listeners want to speak more with you both and learn more about Aspen Growth Coaching, what is the best way for them to reach out?
I would just go to the website, aspengrowthcoaching.com. There's an introduce yourself button on the top.
Wonderful. So I will be sure to put that link in the show notes and highlight the introduce yourself button. Again, thank you so much for being here. This was a really important conversation to have, and I think it's going to help a lot of families.
Thank you.
Thanks, Karen.
Thank you so much for joining us today. Be sure to check out the show notes to learn more about our guests. Be also to check out childnexus.com. There you can get additional information, resources about learning and thinking differences, sign up for one-on-one consultations, or our self-paced mini courses for parents whose kids have been diagnosed with ADHD, dyslexia, or anxiety. Thanks again for listening. Enjoy your day.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.